Hello everyone, my name is Punam and my project is about teenage pregnancy and I will be focusing on global because as we all know that teenage pregnancy is one of the major public health issue facing by the global world. So before I move down to the teenage pregnancy issue, first, I would like to give brief descriptions about the teenage pregnancy. So, in the recent decades, adolescent pregnancy has become an important health issue in a great number of countries, both developed and developing. Most teenage leads to the teenage motherhood. The latest international estimate indicates that worldwide more than 60 million women aged 20 to 24 years were married before the age of 18 years, and about 16 million women 15 to 19 years old give birth each year, representing 11.0% of all births worldwide. Ironically, half of all adolescents' births occur in just seven countries, and those seven countries are Bangladesh, Brazil, the Democratic Republic of Congo, Ethiopia, India, Nigeria, and the United States. In addition, adolescent pregnancy is on the rise, emerging as a serious problem all over the world, and more so in developing countries like India, where early marriage and early pregnancy are long established and well accepted customs. Moreover, teenage pregnancy is one of the dangerous for mother, child, and community. Although teens age 10 to 19 years accounts for 11.0% of all birth worldwide, they also account for 23.0% of the overall burden of the disease due to the pregnancy and childbirth. So, for my teenage pregnancy issue, I will be focusing on the health concerns for teenage mom and their children. And the next one will be the lack of resources. Some of the issues that teenage mom and their children are likely to have are the low birth weight or premature birth. The next one is higher rate of infant mortality. The other one is greater risk of pelvic disproportions, and the last one is poor health of child. And the reason behind all of these problems are teenage moms are less likely to gain adequate weight during their pregnancy, which actually leads to the low birth weight or premature baby. Low birth weight is also associated with several infant and childhood disorder and a higher rate of infant mortality. The low birth weight babies are more likely to have organs that are not fully developed, which can result in a complications such as bleeding in the brain, respiratory distress syndromes, and intestinal problems. So the next reason behind these issues are teenage mothers have a higher rates of poor eating habits than older women, and they are less likely to take recommended daily prenatal multivitamins to maintain adequate nutrition during pregnancy. And my final reason behind this issue is teen also more likely to smoke cigarettes, drink alcohol, or take drugs during pregnancy, which can cause health problems for their babies. So moving on to lack of resources, uh, the education is one of the main resource which can lead to the teenage pregnancy, and the other one is school. The third one is non-profit organizations such as Planned Parenthood. It is more important to have education because education is the main key which actually help teenager to reduce teen pregnancy. For example, when teenage girls focus their attention on planning for their future and they make goal to attend college or university, which can actually reduces the likelihood of teenage pregnancy. uh, Teaching about sex education is one of the important piece of preventing teen pregnancy. We think that many teenagers are afraid to talk about sex with their parents or even with health teacher. But talking about sex is the most effective way to learn about the risky behavior and to avoid teenage pregnancy. There are number of comprehensive sex education programs that gives students reliable information about their bodies. One such organization is Planned Parenthood. It is also a non-profit organization which provide extensive information to teens about having healthy relationship. So in some countries like India, they have child marriage system. When teens are educated, there will be more chances of decreasing child marriage because educated teenagers typically marry later when they are better able to bear and care for their children. So for my informatic tool and solutions, I am going to use mHealth, uh, which is a general term for use of mobile device in medical care. mHealth is a good and easy way to educate people about preventative healthcare services. It is also used for reducing teen pregnancy by providing or educating teens about the risk factor of teen pregnancy. In some countries or in many countries, they do not have Planned Parenthood like US has, but people can use mHealth, which can actually help them and give more preventative methods about the teen pregnancy. And with the help of mHealth, the teenage pregnancy can communicate with their physician or nurses without meeting face to face, and they can share their problems with them with the help of their mobile device, which is really amazing, I guess. So, my last one is challenges. The challenges that I faced during my tools and solutions, which is confidentially. According to our class, it is defined as assurance that information about the identifiable persons, the releases of which would constitute an invasion of privacy, will not be disclosed without consent, except as allowed by law. Confidentially is more important because it helps people to build and develop trust. It is a one of the main key or medical practices in the healthcare. It requires healthcare provider to keep patients uh, personal health information secretly unless consent to release the information is provided by the patients. The challenges that I faced when I was trying to apply mHealth is confidentially because mHealth is the mobile health in the general and it is used in the medical care. The reason why I faced confidentially is because, as I mentioned before in my tools and solutions slide, that pregnancy teenager can call and share their problems to their doctor or nurses. However, sometimes when they share their problems, there is more chances of lie because everything they said or they were saying might not be true. So it is hard to believe or trust them, I believe. And these are my source. So that's all. Thank you.